When we think about access to healthcare, we usually picture the clinical side of the system. We think about getting an appointment with the right specialist, or securing a hospital bed, or navigating insurance networks to cover the cost. But none of those resources matter if a patient cannot physically get to the building. To solve this, the system relies on medical transportation. And from the outside, that usually looks like a physical vehicle, a mechanical wheelchair lift, and a driver pulling up to a curb. That is only the final step of a much larger process. The actual transportation experience doesn't begin when the engine turns over. It starts the moment someone answers a phone call. Long before a van is routed, a non-emergency medical transportation, or NEMT, dispatcher has to map out the entire journey. They operate behind the scenes, building the logistical foundation for every single trip. These coordinators act as vital gatekeepers for the entire healthcare system. If they make a scheduling assumption, it creates a delay, and in medical transit, a delay easily results in a direct denial of access to care. In standard transit, like calling a cab or booking a flight, the primary question is simply, where are you going? In medical transportation, the dispatcher has to answer a much more demanding question. What exactly does this passenger need to travel safely and arrive on time? To answer that, they have to uncover specific variables that regular transit ignores entirely. They need to know if the passenger relies on a walker, whether they have the core strength to sit upright during a long drive, and if there are stairs at the pickup location. This diagram illustrates how those individual variables build a highly specific, interconnected operational profile for every single passenger. If a dispatcher misses one of these details, say they fail to record that a facility requires a side entrance pickup, or that an apartment complex has a locked front gate, the entire plan begins to destabilize. The driver arrives at the wrong door, the pickup is delayed, the facility schedule gets backed up, and the patient misses their medical appointment. The logistics collapse entirely. The dispatcher isn't diagnosing medical conditions or playing doctor. They act as a logistical proxy, translating a patient's physical limitations into concrete operational requirements for the driver. Gathering this specific data is the fundamental architecture required to guarantee a patient's physical safety during transit. To keep that architecture intact, the dispatcher sits squarely at the center of a high-stakes, three-way communication hub. The first point of contact is the passenger and their caregiver. Here, the dispatcher must accurately categorize mobility needs while providing a calm, steady voice to families who are often overwhelmed by the medical process. The second point is preparing the driver. The dispatcher arms them with the right operational context, like warning them that a passenger moves very slowly, while maintaining strict boundaries around protected medical privacy laws. Finally, they must synchronize with the healthcare facility itself. By coordinating closely with discharge planners, dispatchers help clear hospital beds on time and prevent vulnerable patients from bottlenecking in the lobby. Routing software can calculate drive times and map street grids, but an algorithm cannot detect when a caregiver sounds completely exhausted on the phone, and a digital prompt cannot soothe a confused patient. That requires human intuition. In a network with so many moving parts, relying on assumptions guarantees systemic delays. Active, clear human communication is the actual engine keeping the entire operation moving forward. The coordinator answering the call functions as a primary guardian of healthcare access. By securing the logistical details, they ensure the clinical appointment can actually happen. Technology has severe limitations in this industry. GPS tracking and digital routing tools are excellent for creating rigid efficiency, but they cannot generate empathy. That empathy comes directly from the values held at the dispatch desk. When a coordinator prioritizes patience, dignity, and accountability during a phone call, they are making a deliberate standard of choosing people over profit. The tangible result of all this unseen labor is a seamless experience for the rider. When the driver arrives, the passenger doesn't feel like a logistical burden. They feel expected, respected, and physically safe. Slowing down slightly, speaking with conviction. Precise medical transportation safeguards a person's ability to reach life-saving care. It provides vulnerable populations the dignity and trust required to navigate an often overwhelming healthcare system.